Good morning, my friends. This is Lisa, your favorite spoon bunny, and welcome back to the Life Spoontastic. This morning, I want to chat with you a little bit about CRPS and the digestive system. And I'm going to read to you, first off, an article that showed up on the RSDSA.org blog, and it was written by a Dr. Katinka Vandermew, specifically for them. And I'm going to read it to you first of all, and then I'm going to share with you why this made so much sense to me. And so here's the article first of all. The Spero Clinic has gained a reputation for effective, non-invasive nervous system rehabilitation and for the sheer number of people who have found remission after going through our program. Now, editor's note here, I don't know what those numbers are like, and just how many of those remission patients are CRPS patients who were diagnosed after the initial 6-month period that I've talked about, that are crucial to remission and to your prognosis. You being diagnosed within that first 6 months is extremely important in being able to reach remission and a good prognosis for CRPS patients. But continuing, often people ask me why our clinic is so unique in its approach, and I think the answer is multifaceted, but certainly one of the factors that makes this most successful where other approaches have failed is that we approach the body as a whole. This may seem simple, but if you think about it, it is very powerful. When patients are suffering, from conditions like CRPS or Ehlers-Danlos syndrome, they are often bounced around from specialist to specialist. Each doctor only studies the specific symptomatic area that falls within their specific specialty. They do not consider, or may not have knowledge of, how a condition like CRPS may affect multiple symptoms. They do not consider the root of the diagnosis, but rather focus on the various symptoms they specialize in. The autonomic nervous system is a control system within your peripheral and sensory nervous system that influences the function of internal organs. This system acts largely automatically and without any conscious input from you. It regulates bodily functions such as digestion, sexual arousal, respiration, heart rate, blood pressure, and urination, just to name a few. Certain reflex actions such as sneezing, coughing, and vomiting are also controlled by the autonomic nervous system. Within the brain, the autonomic nervous system is controlled by the hypothalamus. The hypothalamus is located just above the brain stem within the brain. This system is divided into the sympathetic and parasympathetic nervous systems. The sympathetic nervous system is largely responsible for speeding up functions within the body and is known as the fight or flight system. The parasympathetic system is considered the rest and digest or feed and breed nervous system and is mostly responsible for slowing functions down inside the body. Think of the sympathetic nervous system as the gas pedal in your car, and of the parasympathetic nervous system as the brake. Pedal to the metal or playing dead. The two things every CRPS patient's nervous system has in common. What if your body was an airplane and your pilot is drunk? The autonomic nervous system, sometimes known as the automatic or involuntary nervous system, is incredibly important to your health, as this system is the master control system that runs every single function in your body. Most of these functions require no conscious thought from you. You don't have to remember to breathe. When you're sitting in an airplane, you don't have to know exactly what the pilot is doing up there in that cabin. You just expect that he's doing his job and he'll keep the plane in the air and eventually he'll land it safely. In the case of most CRPS sufferers, unfortunately, the pilot he's up to all sorts of monkey business up there. And he usually has his hand frozen full throttle. The sympathetic and parasympathetic nervous systems have exactly opposite effects on the body. They essentially work in opposition to each other, but in a way that completely complements one another. As I said earlier, think of your sympathetic nervous system as the gas and the parasympathetic nervous system as the brake. The balance between the two is crucial for the perfect function of every cell in your body. While they're both crucial to the car, they cannot be stepped on at the same time. As many CRPS sufferers unfortunately find out firsthand, this is very, very bad news for your health. The golden rule of the autonomic nervous system is that if one system is up, the other system must therefore be down. And in every single CRPS patient, one of two abnormal states exist. The sympathetic nervous system has had its pedal to the metal all the time, or the brain has been stressed for so long that the nervous system simply plays dead. This is much like an animal which, after fighting for its life, understands that its options are gone, and so it plays dead in a last-ditch effort to survive. This may be the case years before you ever develop CRPS, or your nervous system may be injured, resulting in this imbalance when you suffer from the initiating injury that triggers your CRPS. Sometimes CRPS can even be triggered without a traumatic injury or an invasive procedure because of this. The sympathetic nervous system, fight or flight. This system was designed to help your body fight to stay alive when your survival is being threatened. Imagine you've got a gun to your head. You've got somebody threatening your very, very life. Your nervous system responds 0 to 90 within a split second. And since someone usually doesn't have time to calmly ponder their response to a life-threatening situation, your life is being threatened, your body gets ready to fight in order to ensure your survival. Every small bit of energy being spent is being carefully considered by your body. Nothing is wasted. Energy will be rerouted away from the systems that do not concern themselves with short-term survival to where it can be used more readily to fight an immediate threat. For example, blood will flow away from the digestive tract and skin in order to be rationed out to the lungs and muscles. It is more important under those circumstances to be able to fight using your muscles, or to breathe hard and fast, to run away, because your body will need that oxygen. And speaking of oxygen, the bronchioles, the small air passages in the lungs will open up, which allows for more oxygen into the blood. At the same time, the heart will beat faster. Another physiological change in the body is that the pupils will dilate, allowing more light to enter the eyes. The adrenal glands on top of the kidneys will pump adrenaline in case you need extra motivation besides fear to fight. It will also make all of the sphincters, think of the pressure valves inside your body, the ones that keep your contents inside your stomach, to contract and close tight. So why does this affect you? There probably isn't a crazed gunman in your face all the time, or even every day. Your brain cannot distinguish fear and stress from actual life-threatening situations. Additionally, a very old traumatic event can run in a conscious loop in the subconscious mind. The brain cannot distinguish between this old memory and present danger. The old memory almost acts like a computer virus, messing with the software in your nervous system, and your brain simply doesn't know that this isn't happening anymore. When a person suffers an emotionally traumatic event, a neck injury following a car wreck, for example, and maybe it affects the brainstem directly or indirectly, the sympathetic nervous system will become overexcited, affecting the whole body. This will cause your sympathetic nervous system or fight or flight response to be stuck in the on position day in and day out. And if your sympathetic nervous system is stuck on all the time, your parasympathetic nervous system is turned off. Instead of these two systems working in perfect harmony, the sympathetic nervous system turns into the schoolyard bully, the puppet master, pulling your body's strings and directing it on a disastrous course every second of the day. This will create the perfect conditions inside your body that will put you at risk to develop CRPS and other autonomic dysfunction. I will discuss each symptom in detail after we will explain how the parasympathetic nervous system works. The parasympathetic nervous system: rest and digest, or feed and breed. Think of your parasympathetic nervous system as the system that calms you down, helps you rest and sleep, that precious, precious sleep. Helps to facilitate healing in the body, and deals with sexual arousal. Feed and breed. It functions to counter the sympathetic system. After a crisis or the danger has passed, this system helps to calm the body. Your heart and breathing rates will slow down. Your digestion resumes. Your pupils will go back to normal, and you stop sweating, finally. This system will also cause the increase of blood flow to your GI tract following a meal to allow digestion. It stimulates the movements of your intestines, called peristalsis, that move food through your intestines. It will constrict the pupil of the eye, cause you to salivate when appropriate, and is responsible for getting you in the mood. This system, if activated, will activate your immune system, cause increased circulation to the skin and extremities, and help to release your feel-good hormones called endorphins. It will also decrease your temperature. It is the main control system that promotes healing. This system is usually underactive, suppressed, or turned off completely in those who suffer from CRPS. No wonder you ain't in the mode. She goes on to talk about something called the vagus nerve, which she calls your severed lifeline. She says if you suffer from CRPS, you should familiarize yourself with the vagus nerve, as it is the major player in building the puzzle that forms CRPS. The vagus nerve is the single most important nerve inside the human body outside of the spinal cord. It is one of 12 pairs of cranial nerves. These nerves emerge directly from the brain and brainstem, as opposed to spinal nerves that emerge from the sides of the spinal cord. Each cranial nerve is paired and is present on both sides. These cranial nerves provide motor and sensory information, mainly to the structures of the head and neck. Think sensations like smell, taste, hearing, or vision, for example. These nerves are numbered by Roman numerals. The vagus nerve is the 10th nerve and is the longest cranial nerve. Please stick with me here, as I realize that some of you may be bored by the anatomy of the nervous system. I promise that this nerve matters greatly in the development and therefore also the healing of the neurological symptoms of CRPS. The vagus nerve, meaning wandering nerve, is the lowest has multiple branches that diverge from two thick stems rooted in the cerebellum and brainstem that wander to the lowest viscera of your abdomen, also connecting to your heart and most major organs along the way, such as the lungs. The vagus nerve supplies motor parasympathetic fibers to all the organs except the adrenal glands, from the neck down to the transverse colon. The vagus nerve is responsible for many different tasks, including but not limited to heart rate, digestion, sweating, speech, coughing, fainting, and vomiting, to name but a few. Remember, people who suffer from CRPS also suffer from sympathetic dominance, the schoolyard bully, causing the parasympathetic nervous system to be suppressed or to shut down. This means that people who suffer from CRPS also suffer, by definition, from an underactive vagus nerve. Just to recap, the parasympathetic nervous system is responsible in general for slowing and calming things down, as well as healing and sleep. The vagus nerve forms an electric circuit that links our heart, digestive tract, and lungs to the brain. Let's look at how this nerve affects specific organs just a bit closer. Because of the vagus nerve malfunction, CRPS patients almost universally will exhibit some form of GI symptoms or conditions. These symptoms may be as mild as constipation or as severe as gastroparesis, a complete shutdown of the GI system. Other diagnoses may include IBS, irritable bowel syndrome, diverticulitis, celiac disease, Crohn's disease, and gluten intolerance, to name a few. In my experience, few doctors will treat these problems as a central nervous system dysfunction. It is far more likely that these patients will be prescribed medicine to counteract their symptoms. If they experience heartburn, they will be given antacids. If they are constipated, they will be prescribed medication for that. Of course, this complicates the toxic load your GI system is already dealing with, not to mention your liver and kidneys. The following may cause digestive symptoms, especially in patients suffering from CRPS. Autonomic parasympathetic nervous system dysfunction, turning off digestion and the immune system in the gut, specifically malfunction of the vagus nerve. Overuse of antibiotics causing an imbalance in good versus bad bacteria. Candida overgrowth resulting from a weakened immune system, heavy metal toxicity, or not enough good bacteria in the gut. A poor diet low in fiber, acidic in nature, and high in sugar and saturated fats. Medications adversely affecting the gut. Weakened digestive enzymes resulting in food not being completely digested, or food sensitivities or allergies. The health of your digestive system is directly linked to the health of your immune system. Almost 70% of the immune system resides in your intestinal tract. This branch of the immune system, made up of billions of friendly bacteria and yeast, is responsible for many functions, including proper nutrient absorption, production of vital nutrients produced by bacteria in your gut, detoxification and alkalization of the body, and last but not least, one of the main weapons your body uses in fighting against bad bacteria. While we do not have the luxury of space to discuss every digestive problem or diagnosis in detail, we feel strongly that the digestive system of every patient suffering from, she says fibromyalgia, but we're discussing CRPS here, must be treated as if it is not well. The basic steps necessary to heal the digestive system: detoxify, avoid foods that you are allergic to or get treated for your specific allergies, change your diet, rebuild the gut with good food and good bacteria, nourish the body with healthy and proper vitamins, minerals, and supplements. And in my previous post on the RSDSA blog, I discussed the role that viral and or bacterial infections play in CRPS. These infections can wreak havoc on the GI tract and can also use the vagus nerve as a ladder to go up your systems, essentially reaching the brain and causing massive central nervous system inflammation and dysfunction. It is my experience that the vast majority of CRPS patients also suffer from a GI dysfunction. Doctors must recognize this and stop treating symptoms of CRPS without addressing the underlying nervous system dysfunction. Now, having read the article and having dealt with a bout of pancreatitis myself last December in 2019, this actually made quite a bit of sense to me, because after being hospitalized with pancreatitis for 4 days, I came out of that experience with a changed gut, a very changed gut. As a result of that experience, you know, the only treatment for pancreatitis is to, number one, be hospitalized and be in pain management for the pain, because it's a mother, and to go completely NPO, just IV fluids and pain management through the IV. Otherwise NPO, no food, no liquids, no water, they wouldn't even give me ice. They said that nothing, absolutely nothing, was to hit my gut until the infection had cleared with the pancreatitis. And as I said, you know, afterwards I emerged with a completely changed gut, later to find out that the pancreatitis had been caused by stones that they later found in my bile duct, despite the fact that I had not had a gallbladder in 23 years at that point. How weird is my body? But that, you know, from that point on, I have experienced recurring nausea, just random. I never know when it's going to hit me. You know, any given day I can wake up completely nauseous, completely without appetite. And some days even with that same sort of, I describe it as pancreatitis pain, because it's in the same location. It's the same type of pain. It simply does not last as long. And if it lasts for more than a day, you know, that's when my husband and I have cause for alarm. And so coming out of the other side of that, my gastroenterologist advised me that my best bet for avoiding another bout with pancreatitis, or avoiding chronic pancreatitis, was to clean up my diet. He instructed me to essentially to clean it up. You know, no spicy, no greasy, no fried foods, and no alcohol, was what he said. No greasy, no spicy, no fried foods, no alcohol, and to limit my sweets. Now, coming from a Spanish family, the minute I told my family about my new restrictions and my new diet, that was immediately a collective groan and the, oh my God, that's just not living anymore. But, you know, what am I going to do? Am I going to enjoy my food, or am I going to live in pain for the rest of my life? I would rather not live in pain for the rest of my life. So, you know, I cleaned up my diet, and even though, you know, I'm still living with a very changed gut, and my treatment for my CRPS has changed as well. I'm going through some different types of treatments now that I wasn't before, and I've got medications. I've gotten some medications back that, you know, my doctor had would have preferred to see me off of, but, you know, I have certain other problems other than CRPS. So, you know, there's just no avoiding it anymore, unfortunately. So, you know, it's just one of those things where, as a result of being forced by the pancreatitis to clean up my diet, and as a result of the change in medications, I will say that, you know, my pain is better controlled now than it has been in over 5 years, even though my CRPS is in all of my limbs, plus a couple of surgery and procedure sites. You know, it's still better controlled now than it has been in quite some time. And I do believe that it is because of the change in my diet. Now, am I going to go so far as to travel from South Texas to Arkansas to visit this Dr. Vandermew on the hope of remission without seeing some statistics on these patients that have claimed remission, without seeing how many of them have gone into remission after being, or excuse me, if they've been diagnosed after their 6 months post-injury? I'm not so sure, because I've got an excellent doctor already. Quite honestly, he's beyond wonderful, and at this point, I don't see any reason to leave him unless she's got like dozens upon dozens upon dozens upon dozens of people here in Texas that can tell me, hey, I've had CRPS for 25 years and she cured me. And I had CRPS for 10 years before she cured me, you know? But that's a little bit about CRPS and the digestive system. I do believe that it can apply to certain other neuro disorders as well. When it comes to, you know, I do believe that the gut has some play in being able to treat the whole person. I do. To what extent and to and how far I'm willing to take it, my husband and I are firm believers in all things in moderation, I think. We're not willing to go all in on one thing. We don't like putting all our eggs in one basket, per se. We like to have many options when it comes to my treatment. But hopefully this will help you out at least a little bit. And until next time, my friends, this is the Spoon Bunny signing off. May your spoons be plenty and your troubles be few. Have a great day.